This is Junaid, back with another video, Machine Learning in Healthcare, a Primer for Physicians. In this presentation, I'm going to provide a big overview of the current technology that we're talking about, machine learning, and also other interdisciplinary technologies that are going to work with machine learning. The idea is that how the other technologies have developed over time and what is the game-changing application of machine learning. So let's get on with it. This is the second lecture of the series of Primer for Physicians, mainly providing an overview. The next one will be technical basics. We're living in the fourth industrial revolution. This entitles for us to look through history and how things have changed. The first industrial revolution was all about steam power and railroads, and then we were able to transport. The second revolution was mainly because of electricity and the impact it had from industry to industry. While you were initially doing steam power and generating very local electricity at some points, now we have a proper electrical system, a whole grid, and that actually changed and brought about what we call now as the Industrial Revolution. The next one is in the past 20 years, the automation of production, electronics, and computers. And now this is the advent of the fourth industrial revolution, in which the biggest player is the artificial intelligence. The central player is machine learning and artificial intelligence. It will also include robotics, Internet of Things, etc. The book was actually written by Klaus Schwab, who is founder and executive chairman of World Health Economic Forum. And he translates these different industrial eras and tells that the future, or we're right in the middle from the third to fourth, going from computers and limited automation to cyber physical systems. This will create a complete change, a radical change in our economy, finances, and of course, healthcare. This is a slide from ARK Invest. If you go at the bottom, I do personally invest through ARK Invest. So therefore, please take it with a grain of salt. Either way, this is more of an educational slide. They come up for everyone. They specialize in disruptive technologies and investing in disruptive technologies. As you can see, the steam engine was a big impact on how we moved from 1700s to 1800s. Electricity in 1900s to 1920s had a massive impact on how we did anything. Those were the disruptive technologies of the time. From 1980s, we see the insurgence of computers and followed by the internet. And as you can see in 2020 and onwards, the biggest impact will be the artificial intelligence, energy storage, robotics, gene sequencing, and blockchain technology. And these technologies are going to disrupt every industry. But at the center of it is the artificial intelligence. This is again from the same white paper that was published by ARK Invest. As you can see, what it does is that it actually hones in the artificial intelligence right in the middle of it. The reason it is in the middle of it is because all the other technologies like autonomy, energy storage, robotics, IoT, blockchain, all of them significantly depend on artificial intelligence. If that is something that would miss, all of the other technologies will not be able to provide the benefit we expect it to. Hence, artificial intelligence becomes the core of all the disruptive technologies we're going to see from 2020 onwards, etc. There has been an explosion of ML studies. This is directly from PubMed. It actually gives you the data. If you just write machine learning on the right-hand corner, it's going to show you how many publications of machine learning has been going on. And as you can see, from 2009 to 2019, there has been steady increase, and now it's basically exploding. In the past 2 years, there has been 6,000 studies per year in PubMed, which is mainly for healthcare, for 6,000 studies per year. Why now? I mean, that's the key issue, right? I mean, we talk about the fourth industrial revolution, we see the explosion of studies, but why now has it been changing? The key issue is that we were able to get some groundbreaking things in order. Number one is, of course, exponential computation power. This is the current state. The future will be the quantum level computation. That is something that we're going to see in a few slides where it is going towards. We have the availability of increasing big data, and that big data is going to explode with the Internet of Things in the future. We have cloud storage at the moment that is exponentially increasing in size. However, in the future, we'll be talking about DNA data storage, and this is still not a reality, but a moonshot. At the end of the day, that particular data storage will change the way we store and retrieve data. Today, we're talking about mainly machine learning algorithms, which are narrow AI, task specific. In the future, we'll be talking about true artificial intelligence. Right now, our connectivity is limited with 4G LTE. In the future, we're talking about 5G, which is the crucial benefit would be the low latency. We're talking about compromisable cybersecurity. Tomorrow, it will be blockchain, tokenization, authentication methods. We now work in a system approach of just very limited sensors. And we're going to soon see that Internet of Things is going to bring a lot more sensors, all the way from in-home to hospital rooms. And we're going to see the explosion of that technology as well. However, exponential computer power, increasingly big data, cloud storage, all this enabled us to actually usher into an era of automating and producing machine learning for every task possible. And people are exploring literally, you wouldn't believe if you literally follow this literature on the PubMed for medical. However, in the real life, machine learning is changing the way we do things. The simplest example is Airbnb, Uber, etc. And of course, the most crucial thing, Google search. Well, money is always important. So these non-medical entrants like Google, Microsoft, IBM, Watson, Microsoft Azure, Google Cloud Platform, all these technologies want to come in. And why do they want to come in is very simple. The healthcare expenditure in 2017 was 3.5 trillion, which is around 18% of the GDP. It's expected to increase by 5.5% per year, nearly reaching 6 trillion with a T, not billion, 6 trillion with a T by 2027. The current investment level in artificial intelligence in healthcare is about 6.6 billion, which is also expected to increase exponentially as well. So when we talked about increased computational power, just to put it in numbers, the Moore's law, as you can see, from 1970s to all the way to 2015, the number of transistors have increased, number of frequency on the transistor has increased, the power efficiency has increased, the number of cores are increasing. If you look at the real data, by 2025, that would be the death of the Moore's law. NVIDIA with his GPU was able to push for another 10 years. We were actually talking about Moore's law death about 2014 or so. Things we do have now the computational power to conduct this level of machine learning. And therefore, as you can see, the Moore's law is at the backbone of it. The future, however, will be quantum computing. Quantum computing is a very different form of computing from classical computing, where classical computing, there is bits, which are 0 or 1. However, qubits, the quantum computing bits, has a whole range between 0 and 1, which makes probabilistic computation far faster than you can do on basically classical computing. And the number of CPUs will basically have a linear increase if you are doing the classical computing. However, in the quantum computing realm, the number of increased CPUs will exponentially increase the computational power, which brings us to the quantum supremacy. Quantum supremacy is basically an idea where a classical computer will take about 10,000 plus years to finish. However, a quantum computer will be able to finish that in minutes. Google recently published that it has reached quantum supremacy. Of course, Microsoft and IBM are arguing that is it really true or not. But at the end of the day, they have reached with 53 qubits of software, of qubits of computing power to basically reach quantum supremacy. Again, this is not a moonshot anymore. This is a reality. In some of these cases, we are talking about 5 to 10 years where quantum computing in big data centers will be a reality. Another big issue, of course, is explosion of data from Facebook, social media, etc., YouTube, with petabytes and petabytes. Now we're talking about zettabytes of data is being collected. Interestingly, 90% of all the data was collected in the last 2 years, which created the need of cloud computing. And then, of course, cloud computing is now the norm rather than an exception. World's most valuable resource is no longer oil, but data. Fascinating article, must read, how data is changing the way we work and how it is changing the way we even measure stuff. Again, the most important valuable resource is no longer oil, it is data. We talked about cloud storage a lot. This is a graph that is showing an exponential increase in data centers. Just from 2016 all the way to 2021, we're talking about compound annual growth rate of 13%. Percentage of data centers to cloud centers, collectively the cloud centers will overtake regional, local data centers. Currently, in any hospital right now, there are data centers that they own, and that's how they're functioning. Novant is the one that actually recently switched to cloud, and there are a number of other hospitals that are switching. Even, as a matter of fact, Cerner and Epic are integrating possibilities of cloud storage within their platforms. This is truly mind-blowing. Machine learning, AlphaGo Zero. Here we explore how amazing the power of algorithms are. Just a background. AlphaGo developed by deep learning. Deep learning is now acquired by Google specifically to work on healthcare. If you look through this, the first algorithm needed to be trained that actually beat the current champion. He's currently still the champion of AlphaGo, of the Go game in the world. He's from South Korea. There's a beautiful documentary on Netflix about AlphaGo. If you have a minute, go watch it. From a historical perspective, in 1997, when Deep Blue of IBM got over Garry Kasparov, that was considered a seminal moment in time. But if you look through this, the algorithm to play chess is much simpler because Go, the game, has much more infinite possibilities. And to train Go to beat human beings is at another level. So Alpha Lee was produced, and then it was improved by AlphaGo Master. And then the most fascinating thing happened. They actually created AlphaGo Zero. And as you can see, AlphaGo Zero has generative adversarial network inbuilt, and it was able to beat the best algorithm because at the point of time, there's no humans are already beaten. So in 40 days, not only it was able to catch up, but also beat the best algorithm. And not only it did that, it required no training, no training at all. It just trained itself by looking at all the games in the live, trained itself. Didn't even have to provide rules of the game either. Very fascinating. Look at the Netflix documentary. The difference between 4G and 5G is much higher, but I'm not going to get into a big detail. The issue, again, is the latency period. The most fascinating part is how decreasing the latency will open up a whole host of opportunities, especially in time-sensitive areas. If you're interested in looking at how NVIDIA at Mobile World Congress introduced a new computer system with the help of Ericsson, it ushers a new era of how 5G is going to be integrated with AI and how things are going to be implemented in the future. Very fascinating, cutting edge stuff. This is the CEO of NVIDIA presenting the whole presentation if you're interested. Now, blockchain in healthcare. If you really look through this, people are very skeptical about blockchain implementation in healthcare. And I agree, that is 100% the case. When people think about it, they think about in the form of digital assets or cryptocurrency. That is not the implication in healthcare. Neither is, believe it or not, data storage. What really is gonna bring to the market blockchain in healthcare is number one, interoperability, number two, value-based care, and number three, personal health records. And these are the key areas where blockchain is going to make a difference. These are blockchain platforms in the middle. I think they're already available. A few of them are trying to commercialize. This will sit in the middle for heterogeneous medical data, data from patients, pharmacy, healthcare payers, and make sure that the authentication and the interoperability works with proper security. All of them will still have their own data storage systems, but the blockchain will be used to make sure that the transfer is secure. However, I think the bigger application, and amazingly nobody is really talking about, is that the true value-based implementation. We are talking about value-based care and traditional care. When you define value-based care, what you really need to know how to measure it, and then measure it at a very deep level. And when you have measured at a deep level, then you can actually go back and analyze it. The only way you can do that, in my opinion, is using the blockchain. What is going to be done is going to be tokenized everything. So let's say Junaid Kalia orders too many CAT scans. I would say, okay, prove it. They don't know how to do it. Or Junaid Kalia uses too many consoles. Okay. Or does too many lab, or in comparison to this system, you're utilizing more and more resources as you shouldn't, because we are into value-based. The only way to do is to tokenize everything. And then once these tokenize are done, then the blockchain can be applied. And this way it can be weighted which value makes more of a difference on the patient. So in my opinion, the blockchain will be the key for value-based care application, because you will be able to measure at a very deep level. It's not far off. These are a list of companies that are currently available and providing solutions for healthcare in using blockchain. Again, these are not moonshots. We're going to continue to see a rise in them. Internet of Things. Good article. Blurring the lines between physical versus virtual. We are at the point where we use RFID tags, QR scan codes, etc. And then we're moving towards surveillance. We're going to move towards, helping people with everyday objects. And then eventually we're going to have a system where everything will have telepresence. It is odd that when you say, okay, Google, do this, it's kind of amazing that how they're able to do it. And once you connect all these IoT devices.
Sorry, I don't understand.
When you connect all these IoT devices, the teleoperations and telepresence will make a huge difference, and the data will become automatically collected and delivered to analytics team to produce a change. This is more interesting than I thought. When I read this, I was actually shocked. They have now introduced kilobit-sized machine learning models in tiny IoT devices. Again, it's just not the IoT, it is the artificial intelligence embedded in it that is going to make more of a substantial difference. The first application of IoT is safer hospital rooms. Google and Care.ai joined forces to build safer hospital rooms using IoT. So again, these are not something of a moonshots. We are actually seeing the impetus of these technologies being integrated together. The next lecture will be about the technical basics of machine learning, what is machine learning, what is deep learning, what is deep medicine, what is reinforcement learning, what is supervised versus unsupervised learning, and how are we going to implement these in healthcare. So this will give you a technical basis so that when you're reading articles, you at least have an understanding of the vocabulary that is being used. Again, I'm really grateful that you stuck around to see this whole presentation. Please provide me with feedback, subscribe to my YouTube channel, and visit. And lastly, please share. I would really appreciate it if you could share this, especially on LinkedIn. Thank you again.